My name is Michelle Hamilton, and I'm here with my colleague and good friend, Mara Pinot. We are two oncology dietitians here at the UT Southwestern Harold C. Simmons Comprehensive Cancer Center. This video was created to discuss some ways to manage treatment-related symptoms. These shorter videos, like this one here, will cover each individual symptom. For a full overview, please click on the longer video for staying nourished during treatment.
Several cancer treatments can affect your oral health in a variety of ways. A few of these side effects are listed on this slide and include mouth sores, mucositis, which is inflammation and irritation to the lining of your mouth and throat, dry mouth, and even oral infections such as thrush. This can affect how we eat, drink, and talk, and can definitely affect our diet and nutrition. Depending on your treatment and recovery, it can be fairly temporary or it can last for several days. With good oral care, we can try to reduce the severity and improve your recovery time. So what are the recommendations for good oral care? First off, your dentist is an excellent resource for some additional recommendations, and some patients are actually advised to see a dentist before starting treatment. It is important to keep your mouth moist and stay hydrated. Sucking on ice chips while you are receiving certain chemotherapy drugs can help reduce the severity of the mouth sores and irritation. Continue to practice good brushing techniques with a soft toothbrush and overall good oral care. If you do not floss, consider flossing or using a water pick to ensure that you are keeping your gums as clean as possible. Do not use alcohol-based mouthwashes such as Listerine or Scope, as these can dry out your mouth and cause irritation. If you wear dentures or dental plates, continue to clean them thoroughly. If your mouth is very sensitive, consider only using these implants when necessary. Here is a homemade recipe for a milder mouthwash. This combination of baking soda and salt works like an antibacterial rinse that can help heal a sore mouth and clear out any thick saliva or secretions. Swish and spit, do not swallow. It does work slightly better when it is warm, but you can use this rinse hot or cold. A few food suggestions are listed here, but think of things that are soft and easy to chew and try to limit some of those dry, crunchier foods like chips or toast. These can be a little too rough in the mouth and cause more irritation. We want your mouth to heal as quickly as possible. If you are struggling with a sore mouth or sore throat, you may want to chew your food thoroughly and take smaller bites. We don't want anything to feel too rough or feel like it's getting stuck back there. In order to keep foods moist and add flavor, consider adding a sauce, a marinade, or even a gravy to your foods, and choose moist methods of cooking, such as steaming or crock-pot meals. But try to avoid anything too acidic, spicy, or salty. These stronger flavors can burn, and we really don't want that. Spicy chili or tomato sauce are not your friend when you are dealing with a sore mouth. Here are a couple of products that are currently on the market as of May 2022 to help manage your mouth sores. Oracoat Renewing Melts are a lozenge that contain hyaluronic acid and vitamin B12. They can stick to the side of your gums to help with healing and prevent any additional irritation. Best of all, you can continue to eat and drink when using them throughout the day. Glutamine is an amino acid that can help with healing and recovery. Helios is a glutamine oral rinse that is currently being researched to help prevent mouth sores and mucositis. And remember, mucositis is the medical term for irritation and inflammation of our mucosal layer in our mouth. This combination of a small amount of carbohydrate and glutamine can help with absorption and provide direct contact to the cells in our mouth that need the additional glutamine. Dry mouth can be another common side effect. It can be caused by a variety of medications and cancer treatments, so it is often difficult to pinpoint the exact cause. The most important thing to focus on is drinking plenty of fluids. This includes water, but other liquids and watery foods such as fruit or frozen popsicles or even ice cubes can be beneficial. Try to limit caffeine as it has a diuretic or dehydrating effect and can dry out the mouth. Sometimes sour flavors or even papaya can help break up thicker secretions, but be careful if you have a sore mouth in addition to dry mouth. If you experience dry mouth at night or first thing in the morning, a humidifier may be helpful on your nightstand or bedside table. Make sure to properly clean the humidifier on a regular basis. There are several over-the-counter dry mouth products. These are just a few that we like and recommend to patients. Your dentist is also a good resource for product recommendations, and they often even have samples as well. The Biotene mouth spray and lubricity spray are good portable options. The Xylamelts and Act lozenges can provide more of a long-term relief, but almost all of these products are temporary. Unfortunately, there really aren't many options that provide any long-term permanent relief for dry mouth.
Here's some additional resources. These are resources that us dietitians use on an almost daily basis. At the bottom is the UT Southwestern Oncology Nutrition website. That's a great one to go to. A lot of information just based on what we provide and recommend within our patient populations. American Cancer Institute for Research is another great one. So reach out to either your dietitians on your team or to these resources for more research-based information. And thank you everyone for listening into this presentation. If you have any questions whatsoever, please reach out to your medical team. And if you don't know your dietitian, they can let you know who that dietitian is. And if you do know your dietitian, please reach out if you have additional questions. Thank you so much and have a great day.
Thank you.